Okay, so your job was an exacerbation of COPD. So in terms of when you walked in the door, that was all very well done. Standard precautions or your primary survey was done, and then you started your assessment. In future, with shorter breath, I think it's good to auscultate the chest first and do a blood pressure second. The patient was in the tripod position and you could visibly see they were respiratory distress, so it's good to get in the habit of listening to their chest early on. You didn't comment about the rhythm. It was the only thing out of the respiratory status. Everything else was covered. I don't think you asked about whether it was even or not, but everything else was perfect with your vital signs assessment. Something that you could have verbalised to your partner. She printed you 1 lead. It would have been nice to print 3 leads. A very minor thing because it was a respiratory job, and I did tell you what was on the monitor, so that was all fine. Your treatment was perfect. You gave the correct dose and the correct time frame, so that was all really good. You did need a little bit of prompting from your partner to get further information about the patient's history, which is okay, but it's good to get in the habit of the problem that they're having, whether they've had it before, and what other things that they have going on. So once she prompted you, you quickly did it, which was good. Your reassessment was good. You told me about the drug expiry. You did all that very, very well. And a small comment with the auscultation, it would be good to get in the habit of putting the stethoscope underneath the patient's clothes to get a really good listen of what's going on. It is hard in the scenario setting because I'm going to tell you what you hear and things like that, but just a good habit to get into. Otherwise though, your order of assessment was good. You were able to verbalise all your GCS and your cardiovascular assessment as well. So that was all very, very well. You verbalised it all really well. I think that's it, to be honest, because it was good. It was just a few little things, but otherwise your treatment, you picked the correct CPG to follow. You could have verbalised that you were doing exacerbation of COPD, but it doesn't matter, you still did the right thing. Okay?